Friends, I am Dr. Ghosh. Welcome to my channel, Dr. Ghosh Presents. Signs, symptoms and uses of Spigelia. Full name Spigelia, common name pink root, source, a type of grass, vegetable kingdom. Therapeutic uses of Spigelia: heart affections, neuralgias, cold, constipation, affection of eyes, toothache, worm, helminth infestation, etc. Spheres of action of Spigelia: it acts upon fibrous and muscular tissue of the heart and eye, left part of the head, application of fifth cranial nerve, that is trigeminal nerve, etc. Temperament of Spigelia: nervous. Is Spigelia hot or chilly? Chilly. On the right hand side, the original source, that is type of grass, has been shown, and below it is the medicine. Mental general of Spigelia. Afraid of pointed things like pins, needles, nails, screws, etc. It is seen also in Silesia. Restless and anxious. Gloomy with suicidal moods, offends at trifles, gazes at a single object, sits for hours as if lost in deep thoughts. Physical general Spigelia. Being a remedy for neuralgic pain par excellence, pains are violent, burning like hot needles of wire, jerking, tearing, stitching, radiating of various parts, to various parts. Exhausted and feel heavy easily. Exhausted and feel heavy easily from slightest exertion. Must lie down with orgasm of blood to face and chest. Clothes uncomfortable. Very much adapted to anemic, debilitated, rheumatic and scrofulous subject. No scrofulous subject means subject who has got tubercular dyscrasia, especially children with affected with ascarides and lumbricidae. Actually lumbrici হওয়া উচিত. It is also this symptom is seen also in Shina and sternum. Whole body painfully sensitive to touch. Touched part feels chilly. Touch sends shudder through the whole body. USP. This USP means uncommon, strange, peculiar. This is in homeopathy. The symptoms are divided in few groups. Of that, one group is uncommon, strange, peculiar symptom. This one symptom can give you the direction to a particular medicine. That is, this medicine, if you find this symptom in a patient, you can directly apply Spigelia. This thing, whole body painfully sensitive to touch, touched part feels chilly, touch sends shudders through the whole body. This is rarely seen. Persons have pale face, thin, bloated, weak, wrinkled, yellow, earthy appearance, numbness in lower half of the body, pain in precordium, faints on raising hands above head. Faints on raising hands above head. Another USP. Uncommon, strange, peculiar. This one symptom, if you get this one symptom in a particular patient, you may not look for other. You need not look for other symptoms. You straight go to the medicine. Rheumatic affection of the heart. Now on the right side, two pictures have been demonstrated. One is the doctor is palpating the heart of a patient. Palpation, that is feeling with the help of a palm, and below it the portion, the particular area which is adjacent to the heart has been shown. In heart there are a few points where stethos or the stethoscopes are placed for auscultation. This is called auscultation of the heart. Number one is aortic area. Perhaps you can read this thing. This is the aortic area. This placing stetho here. This is actually between left side second and third intercostal region. This is second costa, this is third costa. So this is a space between second and third intercostal region. Pulmonary area, arms point, tricuspid area, and apical or mitral point. These 5 or 6 positions are generally important for auscultation of heart. But this auscultation gives a lot of information clinically, but that requires training in hospitals. It is not possible to just conversation. It's difficult. General aggravation and ambulation spigelia. Words, touch, motion, jar, periodically, with the sun, tobacco, caution, raising arms after eating, stooping, blowing nose, expiration. Better lying on right side with head high. Inspiring, steady pressure while eating. Head symptoms spigelia. Pain from left occiput to left to over left eye. This is occipital bone. This is occipital bone. This pain moves from this area over the head to the left eye. Worse, from stooping, making a false step, opening mouth, vertigo, mouth. Vertigo, feet feel as if higher than head. This feeling is also something peculiar feeling. Patient feels his heartbeats or heartbeat as if higher than head. Worse from looking down, must look straight ahead. Worse from standing, walking. Supraorbital neuralgia. Supraorbital means above the orbit of the eye. Sensation as if band around head. This sensation is seen as calcarea, sulfur, carbolic acid. Nervous periodical headache begins in the morning at the base of the brain, spreads over the head, locates in eye, orbit and temple of left side, right side sanguinaria, silicea. Nature of pain, pain pulsating, throbbing. Temple means actually temporal bone ke temple. That is temporal bone like here, just above the our ear. This place is temple, because this is temporal bone. This is occipital bone. This is occipital. This is temporal. Eye symptoms of spigelia. Feels too large, that is eyes feels too large for the orbits. Severe pain in and around the eyes, extending deep into socket. Worse while thinking of the same. Squint with arms. Worms. Eyes red, sore, drawing ache, as if needles were thrust in. Profuse lacrimation from affected eyes. Tears accrete. Difficulty in raising the eyelids with painful sensation of stiffness. Latent error of vision, esophoria and exophoria. This type of error of vision is very rare. Esophoria and exophoria. I have shown the picture here. This is actually two types of the esophoria means when the person's one of the eye is towards the nose. This is the normal direction of the eye, but this particular eye is not in actually in tune with this eye. This is somewhat inner. This is okay. Then this type of error vision is called esophoria, and here this is the normal eye, and this goes outside. So this is exophoria. These are two types of error visions. Sharp, stabbing, sticking pain through eyeballs back into the from eyeballs to back into the brain. Worse from damp, cold, rainy weather. Ear symptoms spigelia, periodical deafness, ear feels as if plugged. No symptoms spigelia, chronic catarrh with post-nasal dripping. Post-nasal dripping means nasal dripping from posterior nares. Tickling and itching of nose, dry anteriorly. Coryza, during prosopalgia, trigeminal neuralgia, tic douloureux, suicide disease. Prosopalgia actually is a face ache, aching in the face due to trigeminal neuralgia. This particular disease has got two other names also. One name is tic douloureux, and another is suicide disease. It is very much. This is called the most painful symptom of human, no, though that human experience. About neuralgia, this neuralgia I'll be discussing the next slide. First symptoms of Spigelia: prosopalgia involving eye, zygoma, cheek, and teeth. Temporal pain, suddenly going and coming, worse from touch, stooping from morning until sunset after tea drinking. See, prosopalgia means actually face ache, a pain of face. Its common cause is neuralgia of trigeminal nerve. This is the trigeminal nerve, fifth cranial nerve, coming from the cranium, that is head. Fifth cranial nerve, trigeminal nerve. It has got three particular branches that has been shown here. Some specific areas are there. It will be coming one by one. Suddenly it is this eye, area of eye. Zygoma. Zygoma, actually this area, zygomatic bones. Then cheek, then teeth. All these areas are supplied by nervous sensation are supplied by this particular nerve. So when this nerve is inflamed, there is serious pain, and that is called prosopalgia. Was from touch, stooping from morning until sunset after drinking tea. This is worsening factors. Mouth symptoms of Spigelia: halitosis. Halitosis means bad breath. Toothache, worse from cold air, water. When thinking of it, better by eating. Tobacco smoke, tongue coated, white, yellow, burning, stitches cracked. Throat symptoms of Spigelia: copious mucus, offensive mucus from posterior nares. So this posterior nares is lying just behind our nose, within the above part of the throat. That is posterior nares. When we just draw our nasal airs from nasal like this, that is something from the posterior nair comes to our throat, drops into throat, causing choking at night, causing choking at night. It is also, we get this in hydrostatic medicine. Stomach symptoms of Spigelia: aversion to tobacco smoke and snuff, ravenous hungers, nausea with sensation of a worm rising in throat. Abdomen symptoms of Spigelia: colic with pinching pain in umbilical region, stools of large mucus lumps only, itching, tickling in anus and rectum, worms, very offensive flatus, faints during passing stool. Urinary symptoms of Spigelia: copious urine with frequent urge, mostly at night. Respiratory symptoms of Spigelia. This is very important. Dyspnea, worse from movement in bed, raising arms, must lie down on right side with head. Hydrothorax. Hydrothorax means accumulation of non-inflammatory fluid within the tissue space of the pleural covering. Heart disease, stitches in the chest, worse from least movement or while breathing, trembling in chest, stitching chest pain, synchronous with pulse. Note, synchronous with pulse. Synchronous with pulse, worse from motion, cold air. Actually, hydrothorax, the accumulation of water in the pleural space, this is caused by, there are three causes: heart cause, liver cause, and kidney cause. In Spigelia, we note that this stitching pain is synchronous with pulse. Pulse means heart. So this is mainly heart cause. This is due to heart cause. This picture has been shown. This is a X-ray picture of hydrothorax. when water accumulated within the tissue space of the pleura. The parallel word is pneumothorax. Pneumothorax means where air is actually accumulated. Hydro means water. When much air is pneumothorax. Neck and back symptoms by Spigelia. Neck steep, pain to right temple or pain from left shoulder to neck, cutting pain at left scapula. Heart symptoms of Spigelia. Palpitation, violent, visible, audible. Worse from least motion when bending forward. Systolic blowing at apex with halitosis. Now, I have underlined this systolic blowing. This systolic blowing at apex, does it mean? Apex is the point where the heart, I mean, left inferolateral part of the heart touches the chest. That area is called apex. This is actually here near this place. This is the place of apex. There, systolic blowing means when we auscult with a stethoscope, a murmur, a distinct murmur is audible. That is due to mitral regurgitation. That is mitral valve, the valve lying between left atrium and left ventricle. That is called mitral valve. When that valve is diseased, this systolic blowing is audible with the help of stetho. Violent sticking, compressing pain radiating to throat, arm, scapula. Worse from least motion. These are all symptoms of that the heart is being affected. Soreness, sparring, fluttering, sensation around precordium. Precordium is the region which is related to the region of heart, region of chest just adjacent to heart. That is precordium. There is the soreness, sparring, fluttering sensation. That means palpitation. This palpitation is also palpable or felt other than chest region, and that is neck region or throat or clavicle region. You can also feel this. Pericarditis, rheumatic carditis. Carditis means actually pericarditis is pericardium, inflammation of the pericardium. Pericardium is the covering of heart. Rheumatic carditis means the heart is affected due to rheumatism. Very often it is it happens. Angina pectoris. Angina pectoris, this is the precursor of heart attack. This is heart attack. You see these things. Heart attack happens when the coronary artery is blocked with a clogged with a accumulation of fat. There is cholesterol and various other things, and the lumen is blocked. Then heart attack happens. But before this heart attack, angina attacks comes when it is narrowed down. That is, coronary artery is not getting enough blood. Coronary artery supplies the heart itself. So when that artery is devoid or gets less blood supply, then this angina comes. So angina is a precursor of heart attack. So if you get any patient which is you feel that he is getting anginal attack, please ask him to contact a senior cardiologist, because this is very important for him to take precautions so that heart attack doesn't occur. And this is beyond our scope. This is a cardiologist's scope. So please advise him to contact a good cardiologist. Pulse intermittent, weak, tremulous, irregular. Throbbing of carotid and subclavian artery. You see this subclavian carotid artery, these two are carotid arteries, left and right, and these two are subclavian arteries. The subclavian arteries, you see this in the just over the clavicle, and this you can see just at the angle of mandible. This artery visibly you can see this visibly it is throbbing when Spigelia is required. Extremity symptoms of Spigelia: left arm numb. Left arm numb, left arm numb is very common symptoms of heart troubles. Pulsation in patella. This is patella bone. This is actually knee joint. The above is femur and this is knee bone. That is, there are two knee bones, femur and one is sorry, tibula and fibula. This is tibula and knee joint, femur, where meets there is a triangular bone in front of them. This is called patella. We can see that kneecap, and you will feel a pulsation in the patella. Over this patella, you will feel pulsation. There is surely uncommon, strange, peculiar symptom. Another very important symptom that directly you directly go to Spigelia. From this symptom, you go to Spigelia. No other symptom is required. This is such an important thing. Complementary of this medicine is Calcarea, that is Calcarea carp, and related is Cactus grandiflorus. With this, the video ends. Thanks for listening and viewing. If any trouble is felt, please write down in the comment. I will certainly respond.